The central nervous system is made up of two parts. It's have what we call the spinal cord and then the brain. The spinal cord is made up of what we call 31 pairs of the spinal nerves, of which we have 8 coming from the cervical region, 12 from the thoracic region, 5 from the lumbar region, 5 from the sacral region, and 1 from the coccygeal region, making a total of 31 pairs of the spinal nerve. Good evening to you all. My name is TUMNAD, and in today's video we are going to be looking at what we call the spinal nerve. If it is your very first time to watch me, please make sure you subscribe, you turn on the notification bell so that whenever I load the video, you become the very first person to watch. So let's go ahead and get started and look at what we call the spinal nerve. Now, a spinal nerve, here we have come up with a cross-section of the spinal cord because it is where we are going to be having our spinal nerve coming from. Okay, so now we are just going to first going to a quick recap of the anatomy of the spinal cord cross-section. If you have not yet watched it, please go and watch it such that you become in line. So now this is a cross-section of the spinal cord. We want to see how our spinal nerve is going to be coming from. Okay, now this H-shaped structure is going to what we're calling the gray matter. Okay, it's going to be the gray matter, and then this lateral sides, then the posterior part is going to be now part of the white matter. Okay, and then we said that these kind of the protrusions front and then the back, these are going to be the dorsal horns, or what we may call the posterior horn, or you may even call them the sensory horns, okay, of the gray matter. And these ones are going to be the anterior horns. You may even call them the ventral horns, or you may even call them the motor horns. Whatever you feel like is what you do, is what you take. And this is going to be the central canal of the spinal cord, and these are going to be the lateral horns. And of course, the lateral horns are going to be more on what we call the thoracolumbar region, and then also some part of what we call the sacral region, especially the S2, S3, and S4. You may not find them on what we call the cervical region, okay? And then we said that this is going to be now the ventral median fissure, and then it's going to be the dorsal median sulcus. Now, these are, we want to see these tubes which are going to be coming from the ventral horn and then the dorsal horn. You know, we are going to be having very many rootlets which are going to be coming, okay, from what we call the anterolateral sulcus and then also the posterolateral sulcus. When these rootlets unite, they form one big tube, and this tube is what we call a root, okay? So now, if this one is at the back or the posterior end, we can simply call it the dorsal root. Okay, you may even simply call it the dorsal root. And then this one, which is going to be on the ventral side or the anterior side, we may simply call it the ventral root, as simple as that. Okay, but this dorsal root, it has this bulbar structure. Okay, this bulbar structure, and this bulbar structure is going to be containing a couple of neuron cell bodies. How do we call a collection of neuron cell bodies in the peripheral nervous system? It is called a ganglion. So now, because it is on the dorsal root, we can simply call this one as the dorsal root ganglion, as simple as that. And it's going to be housing this kind of the neuron. How do we call this neuron? It is a sensory neuron. And to be even more specific, it is part of pseudo-unipolar, having a peripheral process and then a central process with this kind of cell body in the dorsal root ganglion. Okay. Then coming on the ventral side, this ventral root is also going to be having motor fibers, and going to be having motor fibers. We have a lot of them. We're going to be having the motor fibers or somatomotor fibers. We have the gamma and then also the alpha somatomotor fibers. We're again also going to be having what we call the autonomic fibers. And of course, when we have the autonomic motor fibers, we're going to be having the sympathetic for the case of the thoracolumbar region, and then the parasympathetic motor fibers, which are going to be more on what we call S2, S3, and then S4. Okay? Now, we want to see how is a spinal nerve formed. How do we form the spinal nerve? Now, when this ventral root and then the dorsal root, when they come and unite, and they come out from what we call the intervertebral foramen, you see this kind of the union of the dorsal root and then the ventral root, they form what we call the spinal nerve. For that reason, this one here is going to be now our spinal nerve, okay? And this spinal nerve is going to be a mixed nerve containing the sensory neurons and then the motor neurons. For the case of the motor neurons, which are going to be residing in this spinal nerve, the motor neurons, you're going to be having the somatomotor neurons, which has the gamma and then the alpha motor neurons, and then also the autonomic motor neurons, which includes both the sympathetic for the case of the thoracolumbar region, and then the parasympathetic motor fibers for the case of the parasympathetic nervous system. And of course, they're going to be preganglionic motor fibers. Okay, we're going to be having preganglionic motor fibers. Now, this spinal nerve is going to be housing all those fibers. We're going to be seeing where are they going to be originating from. Okay, now this spinal nerve being formed by the dorsal root and the ventral root, it is just a very, very, very short distance, like it's like more 1 to 2 centimeters long. The spinal nerve is like 1 to 2 centimeters long. Okay, now it means that the spinal nerve towards the central nervous system or towards the spinal cord is going to be made up of these two, the ventral root and then the dorsal root. And then as you move out from the intervertebral foramen, you're going to be having this spinal nerve splitting into two. It is going to be splitting onto this tube which is going to the posterior end and one which is going to the anterior end. This one which is coming to the posterior end, this one is what we call, you may call it the dorsal rami. Okay, you may call the dorsal rami, which is going up, okay, which is going at the posterior aspect, okay. And then this one which is coming anteriorly, or which you may call the ventral, you may even call it the ventral, the ventral rami, okay. These ones, they are not roots, okay. The roots, they are before the formation of the spinal nerve, but after forming the spinal nerve, it will split into two, the dorsal rami and then the ventral rami. The dorsal rami, they are going to be housing a couple of neurons. Now, you see this ventral horn, it is going to be housing neuron cell bodies of motor neurons, okay? You may even call them somatomotor neurons. They are going to be residing in the ventral horn. So now, when they come out through the ventral root, we are going to be having, we are going to be having the gamma and then the alpha motor neurons. They are going to be coming, they become part of the spinal nerve. They can move to the dorsal rami, and even they can also move to what we call the ventral rami. Now, when they move to the dorsal rami, they can supply the skin, and even the muscles of the back. Okay, they can supply the muscles and skin at the back. Okay, but we also have kind of the sensory neurons which can pick the information from the back and feed it into what we call the spinal cord. You know, we may have some kind of skin pinching or like a needle pinches you. These sensory neurons, they can pick the sensation through these pseudoinpolar neurons through what we call the dorsal rami. It comes part of the spinal nerve, and then it moves through the dorsal root and then enters into the spinal cord through what we call the dorsal horn, which is responsible for sensory neurons. And then of course we're going to be having the motor fibers, which are going to be coming and then cause the innervation or the movement of the muscles of the back, and then also sensations of the skin. Okay, now how about these kind of the somatomotor fibers which are coming on the ventral rami? They are going to be innervating what we call the limbs. They're going to be innervating the movement of the limbs, and then even also the muscles. Okay, even the muscles of what we call anterolateral, of what we call anterolateral trunk. Okay, so now these kind of the somatomotor neurons are going to be the anterolateral skin, and then also both upper and then the lower limbs. Okay, so now that is for the case of what we call the somatomotor neurons. Now let's look about what we call the autonomic motor fibers. Now, for the case of autonomic motor fibers, we have sympathetic motor fibers and then parasympathetic motor fibers. Where do they come out from? For the case of the sympathetic motor fibers, they come out from what we call the lateral horn of what we call of the gray matter. Okay, so we're going to be having the cell bodies of what we call the preganglionic motor fibers are going to be coming out from here for the case of sympathetic neurons. They come out through the ventral root. They come down. They become part of the spinal nerve. Now, when it reaches this area on what we call the ventral rami, we have two kind of tubes here on the ventral rami. See, there is this tube and then there is this tube. Okay. Now, but this preganglionic sympathetic motor fibers will come and enter this tube. See, how do we call this tube here? This tube is what we call white rami communicants. Okay, is what we call white rami communicant. It is where the preganglionic sympathetic motor fibers will come and enter. Now, there are a lot of things which can happen. You see this bulbar structure. This bulbar structure is going to be housing neuron cell bodies. And of course, if you have a collection of neuron cell bodies outside the central nervous system, it becomes a ganglia. Now, because we have this ganglia here, we have this one here, and it's going to be moving up the whole of it like a chain. For that reason, this one becomes the chain ganglia. Okay, they become the chain ganglia. Or you may even call them the paravertebral ganglia, because they're going to be located on the sides of what we call the vertebral column. Okay. Now, what happens when these preganglionic sympathetic motor fibers comes on? When they come to this ganglia, there are a lot of things which are going to be happening. We are going to be having this kind of distress of this neuron cell body. Okay. Now, if it synapses here, we are now going to be having now the post-ganglionic sympathetic motor fibers coming out. Now, they come out from this kind of the tube. How do we call this tube? This tube here is what we call the gray rami communicant. Is what we call the gray rami communicant. Why is it called the gray? It's just because it is animalinated. And of course, if it is animalinated, that axon which is animalinated, it appears gray. Okay, it appears gray. So now, when it comes out, and then it becomes part of the branch of the spinal nerve, which is the ventral rami, and then it comes out. When it comes out, it can go to a couple of different structures. What are these structures? It can come to the smooth muscles. Okay, it can come to the smooth muscles, for example, the erector pili muscle, which is going to be now the pilomotor fibers. It can even go to the glands. Okay, it can even go to the glands. For example, the sweat glands can go to the sweat glands. And of course, if it goes to the sweat glands, the postganglionic sympathetic motor fibers innervating the sweat glands, they don't release norepinephrine. Okay, they release acetylcholine. This is just an exception. Okay, we know that the preganglionic parasympathetic fibers and then sympathetic fibers, they release acetylcholine, but the postganglionic sympathetic motor neurons, they release norepinephrine. But for the case of the sweat glands, it is releasing acetylcholine. Okay, again, we shall see again on what we call the adrenal gland. We have the preganglionic sympathetic motor fibers that leaves the lateral horns and goes direct part of the splanchnic nerve, and then they innervate the chromaffin cells. Okay, when they smith the chromaffin cell, they release the catecholamine, the lack of norepinephrine, and then epinephrine. Okay, meaning that the chromaffin cells in adrenal gland, they will be serving as modified postganglionic sympathetic fibers. Okay, it is such a beautiful thing. Okay, what else? They can even go and innervate the blood vessels. The blood vessels. So now, the sympathetic effect on the blood vessels, you have to be knowing that it's going to be causing vasoconstriction. Okay, it's going to be causing vasoconstriction. Okay. So now, these sympathetic motor fibers, the preganglionic, they can even move without synapsing here. They just move down. Okay, or they can even move this through this tube as splanchnic nerve, and they come to another kind of the ganglia. You know this ganglia? This ganglia is going to be located anterior the vertebral column. You know how it is called? It is called prevertebral. It is called prevertebral ganglia. Okay, prevertebral ganglion, okay, just because it's going to be residing in front of what we call the vertebral column. It has a couple of names. Some people may even call it people may call it even pre-aortic ganglion, or you may even find some other people calling it even the collateral ganglion, okay? But some of these preganglionic sympathetic motor fibers, if they come, they can come and then synapse here and then come out on its own. You know, when this kind of the postganglionic fibers come out on this own, this is going to be part of the splanchnic nerve, okay, if it comes out on its own. We shall look later on this one in detail when we are talking about the sympathetic nervous system in detail, okay? But for now, we're going to be stopping here because this kind of the preganglion fibers, they can even come down, they can even go up and then synapse on different chain ganglia, okay? It is also such a beautiful thing, okay? So now that covers a simple illustration about the spinal nerve. Let's just have a very simple quick recap of what we have just said. We said that the spinal nerve is going to be made up, it's going to be made or it's going to be formed by what we call the dorsal root and then the ventral root. When the dorsal root and then the ventral root unite, they form what we call the spinal nerve, which is just around 1 to 2 centimeters. And it's going to be uniting in what we call the intervertebral foramen as it comes out. We have said that this spinal nerve is going to be a mixed nerve having both sensory and then the motor fibers. The motor fibers can be alpha, gamma, or even can be autonomic, having sympathetic for the case of thoracolumbar region and also parasympathetic preganglionic system from the sacral region, S2 and then S3 and then S4. Then we said that the spinal nerve can come out and then split into these two tubes. You see, the reason why this tube is very small, this tube here is very bigger than this tube which is going at the back, to be supplying the skin and then muscles of the back. This one is large just because it's going to be supplying a bigger part. It's going to be supplying the anterolateral of the trunk and then also the upper and then the lower limbs. That's why this ventral rami is larger or bigger than the dorsal rami. Okay, and then we said that the spinal nerve is going to be housing a lot of neurons. It's going to be having the motor, somatomotor neurons, and then autonomic neurons. Okay, autonomic neurons, we have the preganglionic, sympathetic, and then preganglionic, parasympathetic, depending on the region of the spinal cord. Okay, and then we said that the preganglionic motor fibers for the sympathetic nervous system, the cell bodies are going to be on the lateral side, the lateral horn here, which are going to be coming out through the ventral root. Then from the ventral root comes part of the spinal nerve as it comes through what we call the ventral rami and then enter through what we call the white rami communicants. If it synapses here, the postganglionic sympathetic motor fibers will come out and then will come and innervate 3 different structures, like the smooth muscle, like the erector pili muscle, which is going to be part of the pilomotor fibers, and then the sweat glands, which is going to be now the what we call the pseudomotor, and then the blood vessel, which is going to be now the vasomotor fiber. Okay, all such a beautiful thing. And then we said that these kind of the ganglia that are like chain, they can also be called sympathetic chain. They can also be called the paravertebral ganglion. We said that some of the preganglionic motor fibers of the sympathetic nervous system, they can come minus synapsing and then they synapse on this kind of the ganglion, which is just anterior of the vertebral column, which we call the prevertebral ganglion, or we may call it the collateral, or we may even call it the pre-aortic. And then we have some of these postganglion fibers coming out on their own as splanchnic nerve. They go and supply some parts of the visceral organs. Okay, such a beautiful thing. Okay, now thank you very much for watching. TUMNAD as always. Until we meet next time.